Good morning. This is Dr. Tariq. Today I am going to talk about the chain of infection. The infection means the entrance or presence of microorganisms in the body, or the entrance or presence of pathogen in the body is called infection. These pathogens can be bacteria, viruses, fungi, helminths, protists, or prions. The infectious agents found in hospital are more virulent and resistant to the treatment than microorganisms which are found in the community. Because these microorganisms are exposed to antibiotics daily, and the more serious patients are brought to the hospital, which bring more virulent microorganisms. So we have to adopt a more aggressive treatment policy to kill these bacteria. Certain factors are needed to be present for the spread of disease. This is called chain of infection. The three basic elements needed for infection, spread of infection is source, means of transmission, and susceptible host. But this chain of infection does not complete with the presence of these three. It needs two more elements: portal of exit, by which the microorganism will leave the body of the source, and the portal of entry through which the pathogen will enter the susceptible host. The source can be an infected person or fomite, which is the infected object. Infected object is known as fomite, such as equipment, supplies. It may be contaminated food or water. The susceptible host may be patient, a healthcare professional, or maybe the visitor. Microorganisms can be transformed by contact, either direct or indirect, by droplet, by airborne. The mode of transmission can be needle puncture or airborne droplet. Means of transmission. Microorganism can spread by these five routes. Number one, contact. It can be direct contact or indirect contact. Droplet, by airborne route, by common vehicle, or by vector. These are the final five means of transmission. Transmission by contact. We will first discuss this one. This can be direct or indirect. The direct can be like handshaking, or indirect can be like touching a fomite which is already touched by the patient, or the bacteria pathogens are already there. The fomites can be medical instrument, needle, dressing or bed rail, phone, pencil, computer, keyboard, gloves, and other objects can also act as a source of indirect contact. Next is droplet, by droplet. Droplet are particles generated from the source of coughing, sneezing, talking. Transmission of infection by this route can also occur from liquid splashes or aerosols by uncapping a blood collection tube or transferring blood from a syringe to a tube. Because droplet particles are bigger than 5 micrometer in size, they remain in air for no more than 3 feet, very small distance, not more than 3 feet, then they fall down on the floor. Therefore, droplet infection is likely for a brief period of time and within a short distance of 3 feet. It means that specialized ventilation or air filtering equipment is not needed to prevent the transfer transmission of infection agents via droplet. After the droplet is airborne, we are talking about chain of infection. Chain of infection. Now by airborne transmission. Airborne transmission includes airborne nuclei and dust particles that contain the infectious microorganisms. Droplet nuclei are smaller than 5 micrometer. This is in airborne. Droplet bigger than 5 micrometer, and in airborne they are smaller than 5 micrometer. So they can remain suspended in the air for long period of time. These droplet nuclei can be transported long distance due to air currents. Droplet nuclei may be formed during sneezing, coughing, or by singing or talking. They are also formed during suction or bronchoscopy. Microbes that spread through this route are Mycobacterium tuberculosis that cause tuberculosis, Rubeola virus that cause measles, herpes zoster virus that cause chickenpox, aspergillus and anthrax. These are the two diseases which can also be transmitted by airborne, and they are found in construction industry. Next is common vehicle. Next is common vehicle. We are talking about chain of infection. Next is common vehicle. Common vehicle transmission involves a common source that causes multiple cases. This type of transmission is caused by contaminated items such as food, water, medication, devices, and equipment. Example of this are foodborne illnesses such as salmonellosis and listeriosis, which can occur by ingesting food, for example, chicken or hot dogs, which are contaminated with these infectious agents. Some agents are inactivated in the gastrointestinal tract, many others are not. Now we go to the fifth means of transmission, that is vector. What is vector? These are infectious agents are carried by agents like which are arthropods, insects and ticks. Such organisms are called vector. Mosquito, for example, may carry malaria and yellow fever, and ticks may carry Lyme disease and Rocky Mountain spotted fever. If we want to stop spread of infection, we have to break this chain of infection at any place. We can break it at any level, and that I will discuss in the next video. Thank you.